Hello, good day everybody, and welcome back to another episode of my YouTube channel. In case you're joining me for the first time, I am Dr. Monday and I make content related to PLOB and USMLE. Do feel free to please like this video. If you know you're getting value from it or you've enjoyed my previous videos, please do like this video. It really does encourage and it helps to build the channel. Thank you very much. All right, I know we are all busy people. Without much further ado, let's get to what we have for today. All right, so now let's talk about sinusitis. Today we're going to be discussing about a case sinusitis. First, what do we need to, what are the things we would expect in a patient that has sinusitis? Our patient might present with headache. And what are the things that would be characteristic of this headache? It will be a headache that is worse when the patient is bending forward. Your patient might also complain, in addition to having headache that is worse when bending forward, they might also complain of pain in their foreheads and their cheeks as well. And the patient might also say that they experience running nose. These are the things you're going to look out for. But how do you get out this information from your patient? This goes back to our structure, having Socrates. So first, patient comes in with headache. Explore it. Ask them what happened. When did this headache start? Can you explain to me? Can you describe what it feels like? Does it move anywhere else? Anything makes it better? Anything makes it worse? And you will get your history. And of course, you also rate the severity. So you don't forget to do that. That's very important. Keep that. Remember, after our Socrates, we go back to anything else. There is power in anything else. But we don't say anything else. We say, is there any symptom that you're experiencing that you'd like me to know? It really depends. They might give you the information or they might ask you, like what? Then in that case, what are the other things you expect in sinusitis? After exploring the headache, ask about running nose. Ask about congestion. If there is running nose, explore the running nose. Ask about congestion as well. Ask about any fever or recent flu-like illnesses. That's good. Once you've ruled in your diagnosis, from the time you do your Socrates, you already have an idea this is sinusitis. So now we go to we explore the rest of the nose. So we can ask about, besides any running nose, maybe any nosebleeds, and then we move on. Sinusitis, we know it can cause things like pneumonia as a complication. So ask that. Have you noticed any coughing, any fever, any chest pain, any trouble breathing? Because you know the sinuses as well can affect breathing. So ask about this. You're trying to get your red flags as well. Then you can also ask meningitis. They can be contagious spread. So just ask about, again, you don't spend too much time on all of this, just one or two questions about each of them. Have you noticed any sensitivity to light or any rash on your skin? If you want to do a quick review of systems, that's fine. Any lumps and bumps in any part of your body, again, you can look for cervical lymphadenopathy and maybe just weight loss, but you know that this is not a cancer kind of thing. You move on to the next part of the scenario. So we're still in the data gathering. What else do you need to ask? Personally, I like to ask, has this ever happened before? And if it has happened before, explore it. What was done for you? What did the GP say, or what did the pharmacist say, or whoever diagnosed it? And of course, we go to our prima phtosa. Have you been managed for any other medical condition? Is there any allergies? Do you have any medication? Anybody in your family with similar symptoms? Okay, you don't say with similar medical condition, because at that point you've not even told the patient what the medical condition is. Anybody in your family with similar symptoms, so that's really important there. Then of course we go to remaining parts of that. We can do our DESA. So any smoking alcohol, it's okay. If you don't ask exercise or diet, as far as I'm concerned, I don't think anybody should fail you for that. But again, use your discretion as a physician. Yes, so at this point, then we'll continue with that. We said that our data gathering is not complete until we do psychosocial. Patient might say they've been having it for 5 days or 7 days. You can ask, oh, how has this affected you? How has this impacted you? And of course, we ask our patient, oh, you've been having this symptom for a few days now. Have you given any thought as to what could be going on? Then we ask, what is your biggest worry today? Or besides this issue with your nose, is there anything that really worries you today? Then after that, you could do expectations as well. And that is it. Remember, now we're done with that part. We now go to our examinations. So we don't forget that. You've taken your history, you have to examine. That is the standard. That has been the practice of medicine from the time of medical school. So even now as physicians, we'll still continue in this practice. So now we do observations. After observations, of course, what do you need to examine? You need to check the sinuses. You need to examine the sinuses. You might need to do, or you might just mention examination, you need to do a translumination test, and then you also examine the nose, and then you will check the neck for any lumps and bumps. And I, at this point, sometimes like to add, I will also like to examine your chest, listen to your heart, and listen to your lungs. So again, use your clinical judgment. And that is it for this first half of our data gathering. At this point, if you haven't liked this video, what exactly is the problem? Please just like it. Thank you. All right, now let's get back. This is the point now. After you've done your examination, after you've taken the history, for some of you, you can give your diagnosis. So you can give your provisional diagnosis. Now you can say, after speaking to you and examining you, you did mention that you have a headache that is worse when you lean forward, and also you complained about a running nose. Now, based on the information I've gathered from you and any finding you get from your examination, right, then you say, I do suspect you have a condition that is known as sinusitis. This is something you're familiar with. So this is when there is swelling of the sinuses. Then if you want to be more extra, you can ask the patient. So sinuses are spaces within the bones, and they can become swollen, and this can cause the symptoms that you are experiencing. Is that clear? So make sure you are checking with the patient. Make sure that you're not just rambling and talking to yourself. You're communicating to somebody in front of you. So make sure that the person you're communicating with is responding or listening to you. And if it's not clear, look for another way to explain it. So usually we try to get our definitions from the NHS. Now, sinusitis most of the time is a clinical diagnosis. So that means that you don't really need to do any further investigation. But if you just want to be safe, I know some of you are just like, nah. At this point, some of you would like to do inflammatory markers, checking for levels of infection in the blood. That's all well and good. Now let's talk about the management plan. So you can assure the patient that usually when we see cases of sinusitis, they do tend to clear up on their own, although they might take a few weeks before it clears up. There are things that we can do for you in the meantime to make you more comfortable. So I would advise that you do take lots of water, and that you do rest as well. And you did mention that you're having a headache, so for this I'd like to give you some pain medications. Would that be all right with you? Okay, is this something you think that you can do? That's it. Then also, you mentioned that you have a nasal congestion. So I would advise that you do clean your nose with salt and water spray. You could go to the pharmacy and get a bottle. Is that right? At this point, you can ask, do you have any questions or concerns for me? Now, don't forget that if there are things that are positive in your data gathering, let's say, for example, your patient said they were smoking, then you can advise them that smoking can actually worsen this the sinus infection. I would advise that you do quit smoking. If the patient is comfortable quitting or stopping at this time, that's all well and good. If they're not comfortable, you can offer services as well. Let them know that we do have community services that would help, the smoking cessation clinic that would help with quitting. Now, patient might request antibiotics, and again, this is where you would use your clinical judgment. So clearly, if they've had this for less than 10 days, again, you just reassure them that at this point, or if they're not having any symptoms that, again, that is suggesting of a bacterial infection, this is where we say you use your clinical judgment. Now, if it's more than 10 days, then in that case, you can prescribe antibiotics. And for me, the principle is every time we give a medication, we always talk about the side effect. If you're going to give antibiotics, of course, you will tell the patient, maybe let's say the patient has a very high fever. Let's say that the nasal congestion is getting worse. They're having severe pain. There is no improvement now. At this point, you can say, we'd like to prescribe some antibiotics, but we'll be checking with the drug book and also the trust guidelines to know which is the best option for you. And for the antibiotics I'll prescribe, it's important that you do take it, as prescribed, even when you feel better. And the side effects of antibiotics, but I'll make sure that this is written down for you. Would that be all right with you? Any questions or concerns so far? And that is it essentially for that. Do let me know if you have any other questions or things that you would like me to clarify for you. And if you do want me to make more videos, thank you very much for sticking here today. And again, do not forget to like and subscribe if you've not done that. Thank you for your time. Bye now.